Hello everybody. Today I'm gonna do face and neck lift by threads. The threads I'm gonna use are the mint threads, as what you see behind me. Yeah. And once I will open one of them, I will tell you about the characters of this thread. Now, this lady, as what you see, she needs lift at the forehead. Now, Botox, neurotoxins can do that, but I will show you the technique how to lift the eyebrows. Also lift the cheeks, the upper cheeks, the lower cheek, the jowls, what we call, and also neck. Now, the modern concept of lifting by threads is the same as the lifting by surgical lift, which is the vertical lift. Before they used to lift in this direction, but it's been changed. So the contemporary lift is the vertical lift. And me as a surgeon, and I do surgical facelift, I will implement the same technique, which is the vertical on the threads as well. So here for sure it will be vertical. So it depends on the wish of the patient. In her situation, she has lift here, but if she's willing to have more lift, then we can lift. بتحبيها يسويلكيها شوي منها? Yeah. So she likes to have the lateral eyebrows to be lifted. We can do that, and also we can do the midline lift as well. Now we choose usually in every place that we want to lift, there must be an anchor. The anchor is a strong tissue, fibrous in nature, that it can anchor the thread, and because there's two free ends for the stitch, for the thread. So better to have the anchor in a strong, tough fascial layer, so that the other free end will hold the whole. This anchor will hold the whole length of the thread. So here, as we have the temporalis fascia, so we can use it. So here, if I want to lift, so I will go through the eyebrow, because there is a dent which will last for about 1 or 2 weeks, and it will go gradually. And for me, I do overcorrection, because usually the thread will get loose by time. So within like 1 or 2 weeks, everything will be fine. So we can put one here as well. This is what they call the bony tail lift. And here as well, I will put one here and one here. The anchor will be there for those two, and one will be here as well, and same thing here. So one will be here, one will be here. Okay. So we mark. Better not to put lines like this, because this marker will stay and it bothers the patient. So you put an imaginary target. So this is the point of the entry of the thread, and this is your target too. The same like here. Now here, for the cheeks, now look at the folds. So here we have a fold. We want to lift this fold. And there is another fold here. And there is here, and one is here. Now because the face is heavy, especially in our culture, so either we can apply the thread, have it free on its both ends, or for me, I stitch two together. So each pair will be stitched together. So I have one here. So this area is good, and one is here as well. You can go even deep, but usually the hair bothers you, so We can put one here as the entry points for the threads, and here where I will stitch two together. Same thing always should be on the other side. So here is the one fold, here is the other. Here's one we want to lift, and the jowls, one here and one there, and two holes, one here and one here. Okay, now for the neck. The neck, ladies usually, even men, they love the sharp angle. We can achieve the sharp angle if she has less redundancy, so one thread, either we use those the barbed, four of them, or one to each side, or four, or the double needle one, which is also we can use. This is the point here, and you should try where is the better point. So here is the point. Okay, and if I want to make it better, so I will add one more, which is close to it. Better not to go deep down, because you will have like an elevation in between. So here is the other one to support it, and this is the line we're gonna go through. Try as much as I can not to make it a straight ink, because it's difficult to be removed. And this is the other one. So the anchor again will be here in this tough mastoid fascia. The other one will be here. Okay. You should know before you start that the patient is healthy, having no problems, because we're going to inject an anesthetic. For me, I usually use a plain one, but you can use with adrenaline, provided that the patient has no heart problem, no hypertension. So these are very important things. You should monitor the pulse rate, the heart rate, before doing any injection with these things. Without epinephrine, and as I said, you can use with as well. These are the points where we're going to insert the threads. Now you can add for the lidocaine some sodium bicarb in a concentration of 1 to 5, because by this you will reduce the pain generated by lidocaine injection. We already wiped the face. We wiped it before we start with the antiseptic solution. You should be generous in this entry point with lidocaine, because it will be painful for the patient. Now these are the imaginary lines. So this is line, this is the other one. So I will go through. All the line should be anesthetized, because insertion of threads is really painful for the patient. The technique is not completely sterile. You cannot be completely sterile, because the hair is exposed, but it has to be as clean as possible. The dose should be monitored. So usually for lidocaine, plain one is 4 milligrams per kilogram body weight. So we're still on the safe side. I will clean now. Special consideration to the entry points. One more here. Now why we put it in the hair line, inside the hair actually, because the dent will bother the patient. This dent will go with time, but during this time to get further lift, I do usually overcorrection. So tell the patient you will look like a devil for about 1 week, but it will go. Okay. Now I promised you to talk about the thread. So if you have a look at the thread, it's made like a spiral way or helical way of barbing. These barbs are made not like by cutting into the thread, but they are ready-made, they are like built-in. So as you know, the cut-in will weaken the thread at the cut point. But this comes like one piece. The barb is one piece with the shaft of the thread. So gives this is a 15 centimeter length thread and 18 gauge one. And with helical or spiral barbing. So then where this is my target, this one. As we said, we will make an imaginary line. We go subcutaneous, not so deep, not so superficial. Each two will go through one hole. Now for the beginners, they can start with the same what like we have done here in the eye for the eyebrow. I mean, they can go through 4 holes, and you just pull like this, and you do little maneuver like this. It will help, but the duration of lift will be less, because by stitching, by knotting 2 threads together, the lift will be more durable. Here is the other one. Now imagine that you went wrong. What you can do, you can just come here, you hold the thread with your thumb, you go back, and you correct your plane. You go again. Now here, you try to be at the little bit superficial to have good anchor. Now I pull like this, and then I do like this. Now for the jowls, I will go all the way down, crossing the jowl itself and down to the neck. See where is the thread? Pull more, and then there is some immediate lift, but by knotting the stitches together, it will give more lift. And as I said, we will do over correction better, because the thread will relax. We get lax with time. يلا معلش. Okay. So we will, as I said, we will knot 2 to each other. And I will make it more lax later. Then inside, do this maneuver. So I just by pulling cephalad to the thread, it went in. Okay, now we cut the And this other one is to support the first one. More threads, more support, like the suspended bridge. This is the double needle one. It's this is not very sharp, the end, so which is good, less traumatic. Again we go subcutaneous. Till the post-auricular mastoid region. And we have to look at the middle. Here is the middle where there is no barbs. It will be the middle here. Okay. Now here is a little bit tricky. So you should go next to the first entry and same depth. From same hole, same depth, and subcutaneous. Not too superficial, not too deep. Here is we have tough fascia, the mastoid fascia, and it will help anchoring the thread. We do the same thing before we tighten them. Now we tighten them, and you always ask the patient, because it can strangle the patient. So she will have little feeling of tightening, but if more, then you should relax it. So it will be pulled together. Show this. ده حسيتي بخنقة. Little, you do cheating here little bit. On the other side, you pull like this. But try not to pull much, because you will have a lot of wrinkles in the front. Now we do it for the other side. I mean the other thread. Pull both together. Of these wrinkles will go within like 2 weeks. Now we cut the extra. And in fact, some patients, they like the hole because it gives them more sharpness. But, so we released it. Do a little massage. Okay. Okay, so for the post-procedure care, for 2 weeks, no massage, no sauna, no exercise. When she turns her head, should not be like in a jerky way. Taking shower could be done next day, but very gently. And those holes, 1 here, 2 there, there's 2 here, 2 there, 3, all she will put fusidine on before any water comes on the face, before shower, before prayer. Some antibiotics, usually I give Augmentin twice a day if the patient is not allergic to, for about 5 days. Voltaren for pain. If she has pain also, I tell her to put some cool packs. And follow up usually after 2 weeks. Usually the result is after 2 weeks. For first 2 weeks, and it's very important, you tell your patient that you will look funny. You will look funny once we finish the procedure, because there's dent here and there is like wrinkles here and there, you look over like pulled. All will go within like 2 weeks, so the patient should be patient enough, and everything eventually will be fine. Thank you.